Welcome everyone, Dr. Mandell here. If you're having neck problems, spasming, pain going into the arm, chest, mid-back area, and you notice that those muscles are clamping down on you, you might have been diagnosed as having arthritis, spinal degeneration, bulging disc, or even a herniated disc, well, this technique is going to do wonders for you. So let's review some simple anatomy. Underneath the base of our skull, which is right here, is called our occiput. The occiput sits on the first cervical vertebrae called the atlas. You have 7 cervical vertebrae. You have discs between each vertebrae, and at the disc level you have spinal nerves. They come out of both sides. These spinal nerves make its way out of the neck into the shoulder, arm, and hand. They come out, they go into the chest. They come out in the back, they go between the shoulder blades. They affect all the muscle structures around the neck region. We're going to perform cervical distraction. We're going to use a simple therapeutic exercise band, very inexpensive. And this band is going to go underneath the occiput. And by applying it under the occiput, we're going to tug it upwards as we decompress the discs to get pressure off the nerve roots to get you feeling better. Now, regardless of what type of exercise band you decide to use, make sure it is a lower density band to where you get more stretching. As these bands become thicker, it becomes harder to stretch. It's always good to have less density than more because you could always walk away from the band and take out the tension. Let me show you exactly what you need to do first. So in order to perform this cervical decompression correctly, this part, that's not the end, is what has to go underneath the skull like this, okay? That's what's going to lift upwards. So we're going to take the opposite end, and depending upon what type of band you have, you'll do the same type of thing. So we'll take these 2 ends, we'll put it over the door. As we put it over the door and shut it, we'll lock it in, okay? And here is our traction right here for our decompression. Now watch what I do here. I take this band, I'm facing the door, I'm standing up. The band goes underneath my occipital area right here. I'm always going to hold on to that band and guide it. So I don't want that band to slip. So grab the band underneath the skull. I want your head in about a 20-degree flexion. Not like this, not like this. I don't want the band pulling straight up, and I don't want the band pulling straight out. It's best to be about 15 to 20 degrees with your head tilted forward. Once you get that tension, you'll keep coming back until you feel that nice tug. Right now, the head is going upwards. I feel that pulling, distracting the pressure off the nerve. And I'm going to hold that where it's comfortable. It should not hurt, but you should feel a nice tugging. As we reduce pressure off the nerve, that's going to feel really good, giving you that relief. You'll hold it a couple minutes. You can relax, come back in, take a little rest. You can come back again and do it another couple minutes. You can actually turn your head to the right and you'll feel it pull more on one side, holding that traction in that position, which will stretch open the nerves, the pressure off the nerve, and opening up the muscles and joints. And then we can actually turn the opposite way and you'll feel the other side. You have an option to do one or all of these different movements, and you'll feel a lot of relief in there. So after doing this technique a couple of times, you will learn what your body is capable of handling. You will know exactly the best angle and the best tension so you can get those fast results. So when you do this technique, you always want to start light to make sure your body is able to tolerate that force. And as you start pulling more and more, you will know what your body is capable of doing. If you have serious pain or any radicular or radiating pain, then this technique may not be right for you. But do this technique daily. You will see big progress by reducing irritation off those nerves to get you feeling well again. Please share this video with your friends and family. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.